Hello, everyone, and welcome to this week's What's Up Wednesday, where we are going live with you on Facebook and LinkedIn every Wednesday to talk about our upcoming 22nd annual International Human Trafficking and Social Justice Conference, hosted virtually on September 17th through the 19th. We are exactly 5 weeks away from our conference. The countdown is on. We are getting closer, and we are so excited for this coming up. So my name is Anna Schramm. I am the conference planner working at the University of Toledo's Human Trafficking and Social Justice Institute. And today I have a special guest on with me. Nani Quadrado is the Director of Education for HEAL Trafficking, and she has been a physician assistant for the last 20 years. So hi, Nani. I'm so glad that you joined us today.
It's great to be here.
Yes. So today we are focusing on our healthcare related presentations for the conference. So far this summer, we have talked about our programming sessions, our research sessions, direct service, legal and law enforcement sessions. We've covered a lot of those topics. And I've been saying every week how diverse a conference that we are. And we have a lot of different people who come and speak, a lot of different people who attend, a lot of sessions that you can learn about. And so one of the topics is about healthcare and how healthcare is involved in the anti-trafficking and the social justice field. So before we get into that a little bit more, Nani, can you just introduce yourself a little bit and talk about the work that you do?
Absolutely. I want to break out of my little comfort zone, though, and I want to tell a healthcare joke.
Okay, yes.
How many doctors does it take to change a light bulb?
I can't even begin to guess. How many?
Just one, but they'll need a consult, a second opinion, and ultimately refer you to a specialist. And like I share this joke, Anna, because we've all experienced the perceived bureaucracy and the multi-layered processes within the medical profession. But anti-trafficking work really has always been a law enforcement issue. So as you shared, after 22 years as a physician assistant, and now the director of education for HEAL Trafficking, I'm here because I believe that healthcare is the not so secret weapon in anti-trafficking work. And that's what HEAL does. We equip healthcare workers to respond and recognize trafficking victims without needing a consult, second opinion, or a specialist. I think the cool thing is that as healthcare professionals, we can affect a change in the anti-trafficking space, and that's what we'll be talking about.
Awesome. Well, yeah, I agree that healthcare is the not so secret ingredient in recognizing and responding to trafficking. And so I'm so glad that we include these topics at the conference. And so, I mean, you touched on it a little bit, but like, what is the need for and the importance of healthcare in the trafficking space? Like, why do we even talk about this? And why do we even include these topics in a conference on this?
Thanks. I actually appreciate the opportunity because we all know that no matter what the industry in within human trafficking, it's significantly underreported for many different reasons. So I'm always cautious about data, but what we do know is that 68% of victims of trafficking actually see a healthcare provider while they're being trafficked and their provider is unaware. And this is where healthcare providers can really affect a change. Like you don't need a consult, referral, you don't even need a stethoscope. Like in the healthcare industry, we can be the not so secret weapon in the anti-trafficking space.
Yeah, I love that. I first learned about healthcare's role in the anti-trafficking movement during my master's in social work, and what I had a graduate assistant position to like focus on that specific thing and try to get healthcare protocols into hospitals and learning about it. And I was like, wow, all of these victims are coming into contact with the healthcare system, and you are a little bit more neutral of a profession than, like you mentioned, law enforcement or even social service workers who are seen in a little bit of a higher role, or you're needing something from them. But healthcare is a little bit more neutral, and you have that ability to even like get the the patient alone without a predatory person with them. So I've always been a big proponent of including healthcare workers at the table and a part of the conversation. And so I'm glad that you are here, and you have been a part of our conference for several years. So I'd love to just hear from you about why you keep coming back and what your experience has been with the conference.
It's an honor to be invited back. And this conference is really special because it brings specialists from all over the world to share their expertise. And that's a gift, especially to be able to bring them all to one space. It's, I think what I remembered last year, especially, it's well organized, it's timely, and the topics that you all have curated are really appropriate for what's going on in the world today. And so I'm happy to be a part of it again.
Yeah, we're so glad that you are part of it. And you are part of the people who bring those really timely and important topics to the conference. I love when people give compliments about, the conference and all of the presentations that are there. And I love that as, the organizer of it, but it wouldn't be a great conference without the presenters who come back year after year, who are bringing new and innovative research that hasn't been talked about yet, or talk about programmings that they're doing in their own communities, or, topics that aren't always talked about, including labor trafficking, which is what you talk about a little bit. So you are presenting at this year's conference, and your session is titled Labor Trafficking Cases and the PAIR Tool. And PAIR is an acronym, and it stands for Provide Privacy, Educate, Ask, Respect, and Respond. So I know you're going to be covering a lot of great information in your session, but I like to give you the opportunity to just give listeners a little sneak peek about what you're going to be talking about in your session.
Oh, thanks. And thanks for the opportunity. Well, in last year's talk, we took a close look at what labor trafficking looked like in our communities. And I think most importantly, we learned to look for labor trafficking in underpaid and underregulated industries. And we could see them everywhere around us, like landscaping, hotel, restaurant business, to name a few. But this year, we have the privilege of actually looking at cases and applying my favorite tool, the PAIR tool, to initiate the trauma-informed discussions. I think what we all understand in the human trafficking realm is that nothing moves forward without relationships that we build with the persons that have been affected by trafficking. And so this workshop on this talk will be a very practical application for working with victims of violence, no matter what industry you work in. Obviously, my cases are medically related, but this PAIR tool can be used by anyone. And so I'm excited to share that.
Oh, that's interesting, because I have heard of the PAIR tool before, and it's not necessarily just healthcare related. It can be used in a lot of different fields.
It can. It's really for victims of violence, abuse, and trafficking, of course, is part of that. So really, we've used it with law enforcement. We've used it obviously in healthcare, social work, but it's a really great conversation framing space to start difficult conversations with people who have been victims of violence.
Yeah, that's awesome. And where did the PAIR tool originate? Because I have heard it before. I don't think Heal created, but who came up with this PAIR tool? And do you know how long it's been being used?
So the PAIR tool actually was co-created with Heal and some partners. Awesome. Yeah. So we have some partners, the Pacific Foundation, and then, oh my gosh, I want to say Dignity, but it's not. It's Holly's group, Holly Gibbs group.
Okay. Yes.
And so Holly's team and Heal and the Pacific Foundation on the West Coast actually created the PAIR tool. And it was meant to be a very general conversation starter for trauma-informed conversations.
Oh, that's so cool. I'm learning things myself. So if anybody else who's listening wants to hear more from Nani, it's going to be a great session. Make sure that you do register on our website so you can attend the conference, attend Nani's session. So our website to do that is traffickingconference.com/register. So I do want to talk about a couple of the other healthcare sessions that people could hear at the conference. This is just going to be a couple that I'm listing because we do have over 110 breakout sessions at this year's conference. That is a lot. It's very exciting. Lots of different topics like we have been talking about. But one thing that you should know is that if you are registered for the conference, you have the ability to watch the recordings of the sessions for 3 weeks afterwards. So if there's sessions that are happening at the same time, or you're busy because of a meeting, or even if the time zones don't work out well, you have access to those sessions for 3 weeks after the conference. So if there's one that you hear, write it down, jot it down, and either attend it live or listen to it afterwards. So some of the ones that I want to mention are Dr. Jessica Peck will be presenting on recognition and response of child trafficking, presenting in pediatric healthcare, care implications in a social media, social distancing, and social justice world. Next, we have Dr. Bonnie Price and Mindy Lawsey, who will be talking about At the Intersection of Care and Justice, the forensic nurse's role in responding to human trafficking. Then we have Holly Austin Gibbs, which is the Holly that Nani was referring to earlier that helped create that PAIR protocol. So Holly and Mary Beth Burrell are presenting on tracking human trafficking, evaluating the use of an EHR system in hospital settings to document indicators of abuse and human trafficking. And then Bridget O'Neill, Melissa Purian, and Dr. Kimberly Hogan will be talking about innovative patient health navigator model for victims of human trafficking, insights from a coastal family health center. So I think that those are going to be great presentations, a lot that you can learn about even just in the healthcare field. So I really encourage you to sign up for the conference, and you can view our full schedule with all of those sessions, the healthcare sessions, and all of the other topics on our website, which is traffickingconference.com/schedule. So Nani, is there anything else that you would want to add before we wrap up today?
I did put in the chat a Common Spirit Pacific Survivor Foundation.
Spirit, yes.
Created. But I think what I wanted to say, as I reflect, the work is really difficult, but when we work together and not in silos, we have an amazing opportunity to create great impact. So come join us at the conference. You'll leave ready to take action, and hopefully with some new colleagues so that you can do this work together.
Yes. Well, thank you. I think that that's a great call to action, and the emphasis on collaboration between different groups of people. And that's really what our conference tries to embody. And so I love bringing people together and helping to create those collaborations and conversations that don't just stay at that 3-day conference, but also continue on after in the days, months, years ahead. And so I really encourage everyone to consider joining the conference. You can learn about anything that we have talked about on our website. So Nani, thank you so much for joining us today on our What's Up Wednesday. So as I've mentioned, so everybody knows that we are going live on Facebook and LinkedIn every Wednesday at 12 p.m. Eastern time to continue to talk about the topics leading up to this year's conference. So next week, I'm going to have on a special guest, Dr. Rochelle Dalla, with me, and we're going to be talking about our international sessions. So we look forward to having you back here next week. Again, check out our website for anything that you might want to know. And I hope that everybody has a great rest of your day. Thanks, Nani. Thanks, everyone.
Thanks so much, Anna. Take care.
Thanks.